kick it off. I'm going to go ahead and let the others in. I'll do a quick introduction to the Advancement League and then turn it over to you, but certainly appreciate the time and don't take this for granted.
Okay, sounds good.
All right, apologies everyone. Thank you all for joining. We have an efficient but impactful session here today. Zoom provided some fun technical difficulties for us today, but we wouldn't expect anything else for a short holiday week. So Denise, excited to have you here with our small but mighty organization, the Advancement League. Founded a short year ago as a professional organization dedicated to students, leaders, entrepreneurs, but most importantly, communities. A number of professional organizations have chapters. Our chapters are termed teams, and we're dedicated to social determinants of health. So our cause teams this year are focused on all things affordable housing, mental health, and healthy food. We truly believe in a healthier future and think that we have an opportunity to develop leaders, but also to fulfill our social purpose. And we've been watching and seeing all of the amazing things that you've been doing for the city of Detroit. And certainly are excited to hear from you today and ask questions of all kinds.
Well, wonderful. I am so happy to be here. Thank you so much for the invitation. And so I know I believe I'm supposed to be talking for about 20 minutes and I am incredibly long-winded. So what specifically would you all like for me to cover? And then I think we can open it up for questions, but I can definitely talk about my background. And I'll try not to bore you all with my background. It's not really that interesting. And then we'll talk about COVID and how we are facing COVID in the city of Detroit and anything else that you guys would like to know. So are there specific topics you want me to cover?
Yeah, so we'll continue to admit people as they join. If you all have specific questions for Denise based on the bio or conversations that we've had as a community prior to this event, please do drop them in the chat. You all know our style, pretty free flowing and informal. So drop them in the chat or feel free to jump on video. You should have that ability to do so. I'll kick things off. Would love to hear about your background. And then after that, would love to hear about some of the work that you all are doing specific to social determinants of health. We've seen the taglines. Many of us are leading and living it within our day jobs and understanding that COVID has shined a light on many of these social determinants of health. So I'll stop there and kick it over to you.
Absolutely. So again, really glad to be here. Let me just take you back way back when I was about 5. That's when I declared that I wanted to be a doctor. I just knew that I wanted to be a doctor. I felt like I really wanted to help people. When I was about 10 years old, my father dragged me to University of Michigan to a conference where I met Dr. Ben Carson when he was had just separated the Siamese twins. And I said, you know what? I want to be just like him. I want to be a neurosurgeon. And so between the ages of 10 and about until I got into my freshman or sophomore year of college, that is what my focus was. In fact, I wanted to be the 9th female African-American neurosurgeon because at the time, I'm not going to date myself, but at the time, there was only 8 African-American female neurosurgeons. So turns out I did not like science. Science did not like me either, and I could barely pass my classes. And so at some point, I decided, I think it was late into my junior year or so, that I didn't see myself providing individual patient care. I just really couldn't see it. And I was in the middle of taking a practice MCAT exam. And I said, you know what, I'm not going to do this. And that's okay. So I left during the middle of an exam. And my books are probably still sitting there to this day. But I ran to my counselor, my school counselor, Miss Alzora Holland, who I still keep in touch with.
Hey, if you're not busy, you should join.
Thank you. So I went to my school counselor and she told me, she says, well, Denise, you know what? Have you ever heard of public health? I said, well, public health is for, medical school rejects. And she says, Denise, okay, maybe people who go to medical school and they figure out that they don't want to be a doctor, they turn into, learning about public health. And she says, Denise, you are a natural leader. And that's one of the first times I really had heard that. And so I looked into public health, and public health really looks at taking care of an entire population. And that's where my focus has been for the last, oh my goodness, almost 20 years that I have been in healthcare. So I had a variety of different positions after graduating from UC Berkeley, where I received my master's in public health. And then for the last several years, I was in medical group operations, where I was a young administrator overseeing clinics. Worked in behavioral health for a little while. And then I got a call from Mayor Mike Duggan's office, of course, was the mayor for the city of Detroit. And they asked me if I wanted to run the health department. And I said, no, absolutely not. Nope, I'm good where I am. I was at Henry Ford Health System. I was very comfortable where I was, but I felt this calling. And when you feel this calling, you can't just ignore it. And so I just took a risk, took a leap of faith. And then in September 2019, I was appointed by Mayor Mike Duggan to run the health department. And my job is to provide health and wellness to 700,000 Detroiters. And I love what I do. I am passionate about what I do. And the first couple months, I was learning my job and getting really comfortable with all the different programs. We have over 40 programs at the health department. We heard about something called coronavirus in December. And we started looking at, some of the data and understanding what it meant for the city. And we were looking at other cities. And March 11th was our very first case. And I can stop right there, or I can keep going, but it has been a whirlwind since that time. And I'll tell you that believe it or not, I am an introvert. And so I love doing things behind the scenes. I'm not a public speaker. At that time, I'd never spoken to the media at all. But at that moment, I had to own my truth, and I had to kind of walk in authority. Since that time, it's been about 18 months or so. Detroit has served as a national example when it comes to testing and providing communication in a variety of different avenues for Detroiters. And now our next big opportunity is to put shots in arms. We have our vaccine here, and we've done everything I believe possible to get shots in arms. And I will definitely spend some time talking to you all about that. And our work is not done. We're still in the middle of a pandemic, and we are not going to give up. But that's where we are right now. So I'll pause right there.
Absolutely love it. I'm going to run some numbers, but I swear every introvert that I talk to turns out to be, one of the best public speakers. And, if you look up your name, you've done commencement speeches, you've been talking to individuals across the city of Detroit and beyond across the state of Michigan. So certainly appreciate all the work you're doing. So we can jump right into COVID. Many of us, as I mentioned, are in hospital operations. You touched on something that I think speaks to each of us, and that is that calling and that want to fulfill your purpose. So while our day jobs may be number crunching and FTEs and buzzwords, we all have a want to truly, truly impact communities. And you found a way to, not by choice necessarily, but fall into that work and have that be your everyday life. So COVID, what does that mean to you? And how has that taken over your life as it has took over the world over the past year or so?
Yeah, so COVID has changed all of us, not just me. It's literally changed how we operate. And we've had to pivot quite a bit. So prior to COVID, we were, comfortable sitting in close settings. We were comfortable hanging out with our friends, not thinking that there was some sort of virus floating around. And in March, that's literally when our lives were changed. In the city of Detroit, we lost over 2,000 Detroiters in the last 15, 16 months. Within the first month, we lost close to 200 to 300 of our close neighbors and friends. And every day we had to give a report on the number of lives that we had lost. And it was a traumatic experience to share the number of people who had died. And, we're trying to do whatever it takes just to get the word out there that this is not a hoax. This is not fake. COVID is real, and it's impacting our community, specifically Black and Brown communities. It was trying to literally wipe us out. And so my job was to really focus on communication and education. And that has really been the primary plan all along, just getting the word out there. So Mayor Mike Duggan and I had daily press conferences. We were in social media on every major channel. So Instagram, Facebook, Twitter. We dabbled into TikTok a little bit, had no idea what we were doing, so we kind of pulled out of that. But we had Instagram lives with rappers and yogis and all different types of influencers to let people know that this is something that's really serious. When we actually first, what we did was we noticed that COVID was spreading quite a bit in congregate settings. And so those are our nursing homes, people who are experiencing homelessness, so in homeless shelters. And so very quickly we deployed teams of nurses, and they went out into the nursing homes. We tested over 2,000 nursing home residents within about 10 days. So we really came together. We also partnered with Wayne State University and their students to help us. We also launched a rapid testing clinic, because what we're finding is that, especially in the city of Detroit, with 700,000 Detroiters, there's a huge police force and also a lot of first responders. And so a lot of them were getting COVID. And so we had to quickly set up a rapid testing clinic for them, especially so we could get them back out into the streets so that they could, help the citizens. So that was what our primary focus was. We set up a huge drive-through testing site. We were testing about 1,000 or so people per day. It was really incredible. So we were definitely the model. What it did for me, once again, I was learning my job. In fact, if I can be really honest, in February of 2020, that was my last trip, my last plane ride. I was in Atlanta at the CDC with several other health officers. And then later, I think that next month, I was signed up for new health officer training. So I was getting ready to learn what it meant to be a health officer. But little did I know I would get a lot of practice during COVID. So yeah, I mean, it's been a very interesting ride. Again, like I said, I love being behind the scenes, but this was a team effort. So it wasn't just me at all. I have a huge team, about 250 experts, from epidemiologists to nurses to doctors to the environmental health team. We were all in this together.
Absolutely love that. Just keeping the questions going, you touched on something, and that was education and awareness. We know that on the front end of COVID, again, that reassurance, that building that trust, and some of the things that you all, and we've read, have done a phenomenal job at doing in the city of Detroit. So kudos to you and your team. On the back end, as we started to learn more about COVID, we learned that the data suggested that hospitalizations were linked to pre-existing conditions and comorbidities, all of which are driven by some of the big three social determinants of health. So as you've kind of shifted gears with education and raising awareness, how have you kind of paired the need to get a vaccine with also the need to take care of yourself, take care of your body, and those things?
So we're doing that right now, actually. We're going to be launching a really like a 3 or 4 month communication strategy to tie in the importance of getting your COVID vaccine with just healthy living in general. We know when we look at the health profile of Detroiters, we aren't as healthy as we should be. And so that is one of my major goals as the health officer, is to focus on health and wellness. The problem, though, is that we're encouraging Detroiters to focus on health and wellness, but yet their primary focus right now is how are they going to pay their light bill? How are they going to prevent their water from being shut off? And so it is a collective effort. I've been working with the water department. I've been working with BC. I've been working with the lead department, making sure that Detroiters have what they need so that they can focus on their health and their wellness. One thing I did want to touch on briefly too is when we think about education and communication, especially in the Black and Brown communities, what we know, well, we know a couple of things, but one thing we know is for COVID, Black and Brown communities are 2 to 3 times more likely to get COVID and to die from it. That's what our data has shown us. We also know in the city of Detroit, Black and Brown people, we trust our clergy, We trust our salon and our barbers. Yes, we do. I'm looking at my nails, don't look at mine. But we do trust people that we are more familiar with. And we trust our Block Club presidents, our teachers. And so the message that Mayor Mike Duggan and I have been stating over and over again, that message has been, translated to other influencers in the area, and that has been pretty powerful.
Fantastic. Thank you for sharing that. We do have a question in the chat from Luke, who, by the way, is starting his fellowship in the Mayo Clinic in Jacksonville. And I'll stop there and say really quickly that on this call, we have VPs of population health whose sole responsibility is dedicated to this work, all the way to fellows who are getting ready to start their fellowship and certainly will be entrenched in hospital operations, but also want to fulfill that social responsibility and help communities. And we also have Advancement League cause team leaders who are starting to build these chapters dedicated to this work. So as we close things out, think about, kind of your keys or next steps to those multifaceted groups of people. So Luke's question is, other than collaborating with some influencers, what were some other strategies to gain trust within these communities that don't trust government and the narratives around COVID and the vaccine?
Yeah, so one thing I quickly realized working in the city is that, people may not trust me because I'm a governmental official. And so because of that, there may already be some fear associated with that. One of the things that I tried to do was just be myself. That was very, very important, just to, instead of just being on the media all the time, being on all the different stations and press conferences, but getting out into the community and having real life conversations with people. That's been really helpful. And I brought my team with me, a team of physicians, a team of nurses, to sit down and talk to people. I know I went to a couple of the barbershops, and one of the people who were getting their hair cut in the chair says, Denise, I'm glad we actually see you in person, because we only see you on TV. And so that was a kind of rude awakening for me, is to kind of get from behind the camera and talk to folks. That's been really, really helpful. We have set up several things. We've set up a hotline for Detroiters to call 24/7 and give us a call and ask questions to nurses. That has been extremely helpful. As I mentioned, partnering with influencers, partnering with the clergy has been phenomenal. Partnering with schools and with businesses. And now we're taking the vaccination on the road. So not only do we have these multiple sites throughout the city of Detroit with these vaccination sites, but now we have a mobile unit where we're going where people are. So we're in the restaurants, we're in the bars, we are in the festivals. Again, and now we're actually going door to door. So we have Detroiters who are at home and they're homebound and they can't get to any one of our testing sites. So we have a program set up for them. We also, there's no more excuse. If you call us and you don't want to come to any one of our sites, we can come directly to you as well. You don't have to be homebound. We can come right into your home or vaccinate you on your front porch. We just want to make it extremely accessible. So access is not a problem in the city of Detroit. What we are working on is vaccine confidence. We don't even say vaccine hesitancy, but vaccine confidence. And again, the way that we're going to address vaccine confidence is to have real life conversations with Detroiters, address their fears, and make sure we have answers to their questions.
Fantastic. Thank you. So I know we have a few minutes left. We'll wait for more questions to roll in, but somewhat of a pop quiz question. So just imagine that in addition to your role for the city of Detroit, that you now have a part-time job. And that part-time job is that you are the head of operations for the Advancement League. Within that role, you're dedicated and you have a small team of 7. You have $5,000 from your favorite organization. And your goal is to positively impact all things healthy food, affordable housing, or mental health. Which social determinant are you focused on, and where do you get started? You have some money, you have some smart individuals that are willing to support you, and more where that came from. Where do you start?
I'd probably start with mental health. I think that's an untapped area. I think so, especially in the Black community, we don't talk about mental health. I am a pastor's kid, so I feel as though I can say this freely, is that we have, have this kind of mindset that if you go to your pastor will be able to give you advice. But our pastors were not clinically trained. And so we as a people need to invest in ourselves and talk to people and talk to trained clinicians who understand what trauma is. And I think $5,000, even though it's not a lot of money, it's something. And you can start with basic training, where you can train a set of counselors in your area, or even train your staff to go out into the community to address. I mean, we as a community, we've have had a very challenging past. And so I definitely feel as though mental health should be a main priority.
Absolutely love that. The other two cause teams are feeling left out, but I think that answer applies to many. As it sounds like in the chat. No more questions, but we do have a couple other children of pastors. So
Good.
folks feel you there. And I absolutely love that you touched on something, and that is access and how important that is, especially for individuals who look like us, and we hear the concerns, whether it be our family members or folks in the community. So again, a huge shout out to the work that you're doing all the way down here in Florida, out west. We're watching, we're learning, and we look forward to collaborating with you. So for the two other cause teams, affordable housing and healthy food, same scenario, but let's just say that they've studied the community needs health assessment and they see an opportunity in Detroit. How do they collaborate with someone of your caliber or with your office to further your work, expand your work, but also, lend a helping hand?
Absolutely, sure. So I have someone on my team, Yolanda Hill Ashford, who's amazing. She is the director for public health programs, and she oversees our kind of healthy food, our healthy food initiatives. So she'd be a great person for me to connect you all with, as well as Donald Rencher, who is the director for housing for the city of Detroit. And he'd be a great contact for you to learn. He has been really successful in getting several grants for the city of Detroit, both state grants and also federal grants. So he'd be a great person to connect with. And actually after this call, or maybe even tomorrow, I can send you an email and I can connect you with both of them. Sound good?
That sounds amazing. And I would imagine that every city has leadership similarly to that structure. So we'd love to start with Detroit. Again, promise that we'll keep things efficient and impactful. Denise, you've set the bar high in regards to experts and leaders that we've had a chance to collaborate with. I think this is the start of something. Certainly appreciate you. And if you don't have any more questions, we'll give you some time back in and share our conversation here with the members that were not able to make it today.
All right. Well, thank you so much for having me. This was definitely the highlight of my day. So have a good one, everyone, and feel free to connect with me. I'd love to engage in the future. Okay.
Awesome.
Take care. Bye-bye.